There's a little more time for laughs now at the Wilmersdorf Medical Centre. Even a few months ago, the sheer volume of asylum seekers passing through here had seriously tested Dr. Joachim Sebold and his staff. It's been a steep learning curve.
We actually planned to register up to 400 people per day in that building, which also would have included to examine 400 patients and also vaccinate most of the refugees. So now it's quiet. It's more quiet. We see at the moment about 50 to 60 per day.
Opened in April, this is the first place new arrivals come after registering upstairs in the same building. The arrival of some 890,000 asylum seekers in Germany last year put a huge strain on state resources. But now, with proper systems in place, with far fewer people arriving, doctors here say medical help is readily available, both on a basic level and to those with acute conditions. For asylum seekers like this young Chechen lady, who asked not to be identified though, such care may not last. Immigration officials say only around 6% of applicants from this region of Russia get their papers, and her illness is not grounds for asylum.
I've been sick since childhood, but for the last 2 years I've been having tremendous problems, so much pain in my back. I had a surgery to put metal plates in, but it didn't help. Back in my home country, we went everywhere, but nobody could help me.
German law prevents deportation of failed asylum seekers only if they're likely to die from their illness in their country of origin.
You treat these people just as you would treat any other citizen suffering from the same medical condition and the same medical problems. So clearly it would be unacceptable to send somebody back to their country of origin who's seriously ill and who will not get the care they need there.
Since the start of the refugee crisis, doctors and charities say lawmakers have strengthened the burden of proof for a right to remain for treatment.
I mean, the best policy, of course, would be to treat them as long as it is necessary to have a stable situation and an end point for treatment or whatever. But sometimes it is overruled by the administration, and then they tell the medical caretakers, okay, this is it, now we send them away.
Wann kommt jetzt der nächste Bus mit den Flüchtlingen?
For those arriving, basic healthcare seems assured. It is the seriously sick who might have to leave, whose future is increasingly contested. Guy Henderson, CCTV, Berlin.